Good. So, basically, why planet health? Imagine we are in a starship, like a Star Trek, okay? And we get closer to the Earth, and we could make already a cure of the status of the Earth. What would be the status of the Earth right now? It would be quite difficult status, no? The same way the institutions can really make a nanochip to create, no, to simulate a function, no, function on the lungs, function on the heart. We could have even the whole chip to emulate the function of the Earth in the future. They would not be very happy, because later, I don't want to deep into that because we have super experts here in the room that will explain that, but we are beyond the 9 frontiers, what we call the 9 frontiers. Most of them, we are already beyond them. We want to put a positive, no? We want to display positivity. I think the time of being negative is not anymore welcome. We have to be positive but proactive, and that's why we are going to launch innovation, innovation, innovation. But it's good to know where we are. Basically, of course, everybody, and here there are many experts in the room, has been looking at the healthcare space nicely, because healthcare is nice. And nobody was telling anything about healthcare and having maybe 5, 6, maybe 7% of gas emissions, okay? But slowly, no, we are into the main importance flow of quantity of emissions. And because we want to be healthier as possible and live so many years possible, and we want to have many products, many processes, many things, the tendency will be higher, higher, and higher. And we expect that in 20 years, 25 years, healthcare will be one of the most important, if we have done the homework well of the others, by the way. No? So, and it would be a good signal that healthcare, not food. Not food. That's why we are here in a canteen, no? To celebrate the first Planet Health. Food is the problem. Food is the real problem. 30, 40% of the emissions come from food. Means deforestation to plant palm oil. It means to eat so much meat. I include myself. Some of you will laugh now when I'm talking about that. I accept that. But I think it's important that we realize that meat is super important for prevention, for behaving. If we focus in the emissions of the National Health Service, you can see that medical equipment is 10%. People think that medical equipment sometimes is the biggest. It's like the planes. It's not the biggest, the planes in the overall. Here it's 10%. We have other supply chains as one of the more important, but medicines and chemicals are important. And we'll have later, during the day, a pharma talk about roles and tendencies in pharma, about sustainability, and I think it's very important to see how pharma are also tackling this issue. But of course, the best solution would be to have a real prevention policy implemented. Implementing also value-based care, paying for prevention, and so forth and so forth. And that would be the best to avoid readmissions in hospitals, and so forth and so forth. So everything is related. If you eat healthier, if you buy healthier products, maybe the economy even will get better at local level, healthier, and prevention will be here. And maybe we'll have less emissions. That's important, and of course, many of you know about that, but just to remind what we're talking about. Until now, COP 21, 22, 23, 24, 27, 20, was outside health. Now, health is inside COP already, and it's the main important factor probably in the next years. We, at the States, China, and European Union, we are the main factor, impact. This afternoon, we have a 5-continent talk. We will talk with Washington at 3 p.m. from the Planetary Health Alliance, Chris Lemon. We have here with us Matthew from the Alliance also, Abigail from Washington also. Thank you for coming. We will talk with Luis from Brazil, one of the fathers of the environmental health. We will listen, from Nigeria, UNICEF director of Nigeria, will explain many things. So I think it's important to situate all this in the map. And very quickly, because we don't have much time, children. We have here with us some pediatricians also. Hospital Centre de Déu will be protagonists also. Children are always overpassed. I think it's important to have into account that, because for them and with them we will overcome all these issues. Many solutions, and that's why we are here. The solutions must be taken into account. MedTech, digital health, everybody knows what we are experts from digital health, but slowly we start moving into this other field, okay? And basically at the end, we must have a vision that we are part of the planet, no? And just very quickly, here in the room, many people know very well the difference of that, but also many people would not be able to define the difference between One Health, global health, and planetary health. It's not easy. The academics have not made it very easy, okay? But at the end of the day, what is important is to have innovation in the three of them, okay? So basically, any of the One Health, global health, and planetary health topics and problems is welcome, and we want to launch many of the chapters with that. And with that, let's put just one video about why we need innovation for our health and our planet. And that is the video of global health. And do we have sound? No sound? No problem. So basically, as you know, and from the pandemic, we were there 3-4 years ago. Basically, all of us tried to help in one way to another. And we understood that with digital, we could transform the approach to healthcare. And of course, maybe we have forgotten, and even there has been rollback to older positions, no? But I think that if we could do, and many here in the room, I recognize many people that during the pandemic did an amazing and extraordinary things. And I remember that what it was impossible 6 months ago, before, it was possible in just 2-3 weeks, no? And you did many, many, many important things. So I think it's important that global health, has this push, if possible, with realism in that sense. So all that, starting with global health, but also with One Health, okay? The video of One Health. Obviously, this is a quite interesting image. One Health, and of course, One Health is super important. Many will have with us Sarah Soto, I think, later, and yes, Sarah, she will explain about waters, systems, bacteria, and so on, and the possibilities, okay? And where we're expecting in that sense. The biggest innovation will come from here, and I think that all is quite related in that sense, global and One Health together. It's really sad that the potentiality of this sector is not well, we don't take advantage of that, okay? And it's not possible to blame on all that the pharma industry. Pharma, wonderful things, has wonderful objectives. They cannot target every single thing. There must be frameworks where we can really help people that have already some really molecules to target the problem, okay? So if we continue, in that sense, sorry about that, you cannot imagine how difficult has been the last week, all that. So we have to make an applause to Jordi. Thank you. Make an applause. And also, we'll do later another applause for the super team because it's been amazing. So we have problems of time, but we will accelerate now. Not only it's digital, global, planet, whatever. We have a lot of networks. I invite you to participate in a network called Space and Global Health Network in Geneva. They are collecting data, they're making seminars, they are giving for free all the data that you need from many satellites that is already there, but well cooked. And together, you cannot imagine how much they want to work with you, with all the institutions, governments, and so on. So I think it's very important to put all together. Digital exposome, okay? Many of you know what exposome is, but we have already many studies with digital exposome where we can compare citizens in different neighborhoods, exactly how they are really experiencing the different determinants of health and socials in their city, and of course the environmental thing. Very quickly, everybody knows that I come from where I come. As many of you has told me that you will not explain what you do because later there will be many pitches. I will use only 30 seconds of where we're going, just to not be fair. It's 30 seconds in the hot moment, 4 minutes, 5 minutes people. You know that I came from digital, we kept moving with Universal, but we launched UDA, prevention, we're moving there. And slowly, we've been configuring a tool implemented with many companies, associations. We have here a colleague company called MERS that is helping us a lot. And also, we are now implementing interventions, which is the future. 70% of people should be embarked in these programs. And slowly, we have launched something called MP8 Health, which is the 8 Ps: personalized, predictive, preventive, participative, populational, primary. And if you have more Ps, no problem. We put the 8 as infinite, and we have more Ps for you. But the question is, governments should be doing that, no private sector. Governments have a wonderful primary care system that we can really miss it in some years if we don't put more resources. And as a family doctor, we have a program called PAPS, the PAPS. And family doctors should be implementing PAPS program to the population. And it will be much cheaper for everybody, no? Obviously, it's much sophisticated and Harrison Ford in the TV to have a surgeon saving the life of somebody, or implementing an innovation with a stroke in a big hospital. This is much more exciting. And of course, some of you have done this work amazingly well. You are not the leaders of these programs. But for the society and its common sense, we have to really innovate in the way to proportionate. And as always, we are missing here the people who pays, no? And I recognize my failure with that. If we don't invite the people who pays, we will not change everything. So in that sense, it's very important, no? So that's why private people, we're going to start to do that. Prevention for the person, and basically we'll do visits of 2 hours with programs and prevention. And basically, just to tell you, after 2 minutes talking about myself, as a family doctor, I was surprised that the people of planetary health invite me as an entrepreneur, because normally we're all academic, and that was the signal, to participate in the planetary health roadmap together with Pedro Bajals of WHO. Thank you, Matthew. And basically, we participated in that roadmap together with many academics in Kuala Lumpur. And basically, it was quite interesting. Okay, thank you very much, because I think research and entrepreneurship must go together. Finally, instructions of the journey, okay? We need to have, after all these sessions of pitches that you will listen now, and the roundtables, we need to have brainstormings of 20 minutes. You will see a paper in your table where you can put there, after the brainstorming, all the bullet points or projects that you believe are related with the topic we'll be talking, burden of disease and so on and so forth. We will create a list, not only here in Barcelona, Madrid, Geneva, Rome, all the places of the world, adding all these projects related with that. And you will be then aligned to investors. Basically, that's it for the first topic, for the second and the third of the journey. And thank you very much. Thank you to all of you, because without you, it's nothing. Collaborate, please, start to talk together, and let's go for the first roundtable. Thank you very much. Thank you.